Hello. For this week's entry, the question: describe a significant event in patient interaction that I had experienced up until this date in my nursing career. One specific event comes to mind, and this is a 45-year-old patient I had that was dealing with some depression. She was very withdrawn, and she had been having suicidal ideation because of some personal issues and also some financial stressors that she was dealing with. And I was her primary nurse, and I worked with her on day shift, so it was a little difficult for me working with her because it felt like it wasn't anything that I was doing to get through to her as well as other members of the staff. She did a lot of withdrawing, which made it harder for us to have a therapeutic relationship with her because she didn't want the help that was being provided. When reminding me in that particular case of the PMH&P role, I would say understanding that it's very important to create a therapeutic space and safe space for the patient, which is a very important role of the PMH&P, and tailoring her treatment plans to things that were specific to her, and which in her particular case, it wasn't about talking and being able to open up, but it was more about just being there and letting her know that we were available. And it was more of a listening and watching and observing to find out exactly what was the best thing for her. When exploring my strength and limitations with this particular situation, I would say my strengths were being able to be patient and empathetic despite her reluctancy to engage with us. And with limitations, I would say focusing on fixing the situation rather just allowing the therapeutic process to work. With my therapeutic use of self, I learned to use myself as a therapeutic tool by being positive regardless and authentic with her, and showing her that I had principle and recognizing one in particular by Carl Rogers, patient having a person-centered approach. And instead of trying to solve the problem, actually focusing on being present and validating her experience. With specific learning and application in future practice, with reflecting on this event, I learned the importance of balancing action with patience. Not every problem needs an immediate solution. Sometimes we have to be just have the same time available for them like other patients, but some people may just take longer to get over whatever they're going through. Of course, creating a safe space for her and listening, and made her feel like making her just like any other patient feel that she was being understood. And in the future practice, I plan to integrate this insight. Some of the ways is prioritizing patient autonomy, which is very important, as well as refining active listening skills, which is significant in any form of healthcare and any role in healthcare, and also using silence effectively. That is something I think this patient taught me more than anything, that silence is okay. It's okay to just sometimes be there and be present and not always speak and talk, because some patients just are not ready. So we just have to be willing to have the time to wait for them. This experience with this particular patient just reinforced some of those things that I just named, and the importance of just being able to focus on the patient, because at the end of the day, that's who we're here for. Thank you.